think every patient is different. So first things first, I divide surgery, the post-op surgery course, into what does my life look like for the first 2 weeks after surgery? What does my life look like for the next 2 weeks after surgery, so the first month? And then what does my life look like the first 6 months after surgery, 1 year, etc. The first month after surgery, you leave hospital anywhere between 1 to 3 days after surgery. You're on a liquid diet once again to allow that stomach to heal, usually for about a week to 2 weeks after surgery. You transition over to pureed foods for 3 to 4 weeks after surgery, and by week 4, you're eating solid foods. You're just chewing them really well. And we go through all of these nutritional meal plans after surgery and what your pre-op diet looks like and your post-op diet looks like, so the diet before surgery and after. And then most people return to work at about anywhere between 2 weeks to 4 weeks after surgery. We ask for no heavy lifting, so nothing heavier than 10 pounds till about 3 months after surgery, because you still have little incisions in your abdomen and you want to make sure that they heal properly and that you don't get a hernia or any problems with those sutures. So for the first 3 months, no real heavy lifting, but you can be back at work if you have a desk job, quite honestly, at 2 weeks. I recommend people don't return to work for 4 weeks, because it's at 4 weeks that you're really adjusting to this new diet and it allows you some time at home. So if you can take 4 weeks off work, you should. Anywhere between 4 weeks to 3 months after surgery is what I call the trial and error period. It's where you're getting adjusted to what foods work for you and what foods don't. You're getting also adjusted to sort of regular behaviors, this new pattern of eating and drinking. From 3 months on is where life pretty much returns to the normal way, of course, with this new way of eating. And then at 6 months is when we'll make sure we do all the blood work to make sure that all of your vitamins are okay. We'll make adjustments in your vitamins, either cut them back or add in, etc. Between 6 and 12 months is really, you know what kind of foods work for you, you know which ones don't. You've adjusted, quite honestly, to patterns of things like celebrations and eating out and family dinners and those sorts of things, and that's where all those new habits kind of stick in. And then it's usually in the second year where, things really just continue life as normal. Within all of that, you also have, what does my life look like from a weight loss perspective? And realistically, the first year of bariatrics, post-bariatric surgery, is where patients typically lose the majority of their weight. So we say that with sleeve, for example, you'll lose about 1/3 of your body weight. Typically, a good third of that is in the first 3 months after surgery. The remaining third is within the next 3 months. So by 6 months, most people have lost easily anywhere between 50 and 60% of the weight they're going to lose. And then it's in the remaining 6 months that they lose the rest. Now, these are general broad strokes of things, and understand that every patient is different. But we know that looking at the scientific data, that it's really within that first year after surgery that much of the significant weight loss is had. Year 2 is usually sort of a definite slowing of weight loss. Patients maybe lose another 10% body weight as a rule. And after year 2 is when we know that people are most vulnerable towards weight regain. And that has to do with the idea that even though this is a treatment, it's not a cure. So, for example, with coronary bypass surgery, like when you do a heart surgery, we know that within 10 years, the bypasses that they put in run the risk of getting blocked again, even with the best medications in the world. And that's because it's a disease. And whatever caused the arteries to get blocked again, it's still going on, even though you've tried to alter it. Even if you remove 80% of the stomach, and even if you bypass part of the small intestine, you may be addressing several of the hormonal abnormalities, but in the good majority of patients, you're not shutting off whatever sort of mismatch is happening. And that still goes on. And so although you're bringing it definitely to a halt, or you're definitely putting a dent in the process, it's not a cure. And so one of the most responsible things I think that we can do in medicine is to follow patients after bariatric surgery really aggressively, particularly at year 2 onwards, to ensure that if anything, they're achieving weight maintenance, that weight, and that's one of the big goals that we look at in our clinic. And sometimes it involves intervening with a bit more aggressive nutritional management, making sure that they're doing all those nutritional behaviors that I think in year 1 was so keen and great, but life took over, so to speak. Also making sure that, in some patients we add in medications as an add-on to what they have to help them as well with some of the other aspects of their obesity. So, for example, we might use medications that help particularly with cravings or something to that effect that sort of add on to that picture.